Hi, my name is Corrie Black. I'm a physical therapist here at Portland Myofascial Hip, along with Jamie, Spencer, and Rachel. Today we are going to continue with our self-care home series that we're doing. We're talking today about how to do some self-release care for hip flexors, psoas. Psoas is a big stabilizing muscle in the trunk. It lies under the intestines and originates up at the front of T11 and T12 and comes down and inserts into the front of the hip. It's a big stabilizing muscle that also provides a lot of pain and discomfort at times as it proves to stabilize in times when perhaps it's not quite needed. We're going to start with a position on our back where if it is a really tender and sensitive area, you don't end up applying a lot of pressure with the ball. We're going to use a 4-inch ball that we have here at the clinic. Some people are familiar with the rolling out techniques and use harder balls, lacrosse balls, tennis balls, etc. Those are really hard, and so you do want something that has a little bit of squish to it. It doesn't have to be this size, but this is the size that tends to work well in most body parts, which is why we use it here. So you're going to lay on your back, and with the ball, we're going to look at the side of the trunk, and you want to start about 1 inch or 2 out and away from the belly button. And in that position, you're just going to apply a small amount of pressure with your hands through the ball. That might be enough for you if it's really hot or tender. If it's not, then we'll actually turn over onto our bellies, which we'll do here in a moment. But in this position, once you've found that hot or tender or irritated spot, you wait. And you're going to hold it for 1 minute, 2 minutes, 3 minutes if you can, in an effort to slowly let things just calm down, let go, and release. This is one of those times where you want to be relaxed, so perhaps you need to have your legs down. Maybe you need to have pillows underneath to support. Perhaps you need pillows underneath your head. But you want to be in a position of comfort where you're going to be able to hang out in that position for a period of time. Once you feel like things have let go, you move up towards the ribs, because that is where that psoas muscle is originating. It's actually coming up and through the diaphragm. So you can have diaphragm restrictions and lower rib cage restrictions that are in part due to that psoas being tight. Again, you hang out here 1 to 3 minutes if you can. Once you feel like that's let go, you can start working down towards the front of that hip. You can come all the way to the inside of the hip bone. You can also come onto the hip bone if you feel like that's irritable. Again, if this doesn't feel like it's heavy enough, then this is where we turn over onto the belly. On your belly, you're going to have a lot of pressure with gravity and your body weight coming through the ball. So it very well may be irritating at first. You may want to do it on a bed or a really soft, squishy surface so that it ends up giving you a little bit of cushion. But that ball you're going to take again about 1 inch or so away from the belly button. And you're going to come down and you're going to try and rest and relax down in a comfortable position with that ball doing the work of the pressure into that psoas. Wait 1 to 3 minutes until you feel like things have let go. If it hasn't let go and it's too irritating, you can turn slightly off of it, elevate that foot, or that knee rather, and you can hang out and rest in that position until things have lessened. Once it's lessened, then you can start to put a little bit more pressure back onto it. Once you feel like that's let go some, you can bring that ball up again, up towards the ribs. This is a pretty spicy spot for most people. It tends to be pretty irritating. So again, maybe you need to rest down with some pillows. Maybe you need to elevate that opposite knee. Once things have let go, you move that ball down again towards the inside of the hip bone. Here it can get a little confusing. If you come down right on top of the hip bone, maybe that is tender and maybe that is a good spot for you, but it's also not where that muscle typically in those fascial insertions typically lie. So you want to bring it just right to the inside of the hip bone. And again, you can bring that knee out if it feels like that's helpful to get deeper into the inside of that hip. You hang out, you rest 1 to 3 minutes again. If it feels like you need to stay longer, stay longer. If it feels like you need to add a little bit of pressure to it, perhaps it's ready for a little bit more pressure, you can start to come up onto your elbows in a baby cobra type of position. When you're doing self-care with the ball, the biggest thing to remember is that more pressure and harder leverage isn't necessarily the best thing. You want to find that area of tenderness, tightness, pain, irritation, or even symptom response, and you want to hang out and hold it there, easing into it without driving through those painful restrictions and irritating points. Part of that is continuing to be aware of your own restrictions and not just hammering through them. Part of it is allowing your body just to relax and wade into those restrictions, a much needed thing that we tend to not do in our daily lives. I hope this is helpful for you. Please visit us at portlandmyofascialrelease.com. We also have a YouTube channel that you can find on our website there with some other helpful hints. Thank you.